Depinder Kapur is a senior development and WASH expert, worked as country representative WaterAid, as director NRM at CARE, program and advocacy lead at Oxfam, national coordinator of WSSCC, SPWD and AKRSP. He was leading the Sanitary Capacity Building Program initiative of National Institute of Urban Affairs, and he has also worked with Ministry of Urban Development. He is principal trustee of Indian WASH Forum, a national advocacy coalition, and member trustee of Environmental Law Research Society and a part of Citizens Initiative on Water and Sanitation in Delhi.
So what I'm going to share with you is something which the National Institute of Hydrology may not know in terms of typical WASH issues and challenges. And I've tried to link it up with something on water and sanitation from a hydrology perspective as well. So I'm very happy to share with you this presentation. It's in 4 parts. So I'll start off straight away with my presentation. I am representing the India WASH Forum here, and my email address and the website of India WASH Forum is also given for any further reference, and this presentation is also uploaded there on that portal. Next slide, please. So what we will cover here is understanding the context and definitions, because WASH stands for Water, Sanitation, Hygiene. What is the scope of this relevant for this learning event? What are some sector-specific cross-cutting challenges and priorities and way forward? So the purpose of this lecture is to equip the participants with an understanding of core water sanitation hygiene concepts, frameworks, and tools. Next slide, please. Next, please. So the joint monitoring program of UNICEF has defined water sanitation hygiene in terms of ladders, in terms of standards, you could say. So the JMP stands for the Joint Monitoring Program of UNICEF. It defines these 3 categories of drinking water, sanitation, and hygiene into safely managed, basic, unimproved, and not covered. So there are different definitions here. So what is a safely managed drinking water and what is a basic drinking water is different. Similarly, what is a safely managed sanitation and what is a basic sanitation is different. And the same applies for hygiene. Can you go down, please? So this is the next part, improved, unimproved. So here again for water, sanitation, and hygiene. So what may be considered as improved is drinking water from an improved source for which collection time exceeds 30 minutes or a round trip, including queuing. And what is unimproved is drinking water which is unprotected. Similarly, using an improved facility for which is shared between 2 or more households, can be is different from use of pit latrines without a slab, which is unimproved and constitutes a very poor water supply. So therefore, these are the standards and definitions. I don't want to go into detail. I'm just telling the context and scope and definitions part in this slide. Next, please. So if you look at the population, because the 21 census is not yet done, so we have data from 51 to 2011. And if you see the kind of population growth, which shows an urban-rural trend, there you see the lowest part, which is the hamlets of smaller than 1,000. Their size, their population percentage has come down from 43% to 12% in 2011. Whereas the million plus cities, they constituted about 10% of the population in 2011, and other class 1 cities constituted 7%. So together they constituted 7% of the total population, whereas in 1951, the first graph, if you see, it was just about 3 or 4%. So we've seen these smaller hamlets, smaller villages, medium-sized villages, they are shrinking. And what is increasing is either these class 4, 5, and 6 towns or class 3 towns and above. So a lot of my presentation, because I worked with the National Institute of Urban Affairs in the last 5 years, was looking at urban sanitation and water challenges. So a large part of my presentation covers those aspects which are perhaps new and relevant to the National Institute of Hydrology and the participants of the webinar. So here is the more detail of the same graph. Here you can see how the class 1 cities have, their population percentage uh, has increased. Uh, in census 2001, percentage of urban population in class 1 cities was 60. This is the urban population percentages. Uh, yeah, I think this, I don't need to go into the details. Only if you read on the left side, class 1 cities 70 constitute about 70% of the urban population. Therefore, a lot of our urban missions and sanitation programs focused on class 1 cities like Amrut. Amrut was on 500 class 1 cities with a population of more than 1 lakh. So similarly, a lot of our initiatives, which is there presented in the next graph, I will explain that how it is related with the urbanization trend. Can you go to the next graph, please? So this is a journey of urban sanitation capacity development, which we prepared in NIUA. It explains the how the progress has happened in the last 20 years or so. So, starting from the Jawaharlal Nehru National Urban Renewal Mission from 2005 to what is there as Mission Karam Yogi today, we try to map different capacity development initiatives in line with the national missions and programs. So, while the JNNURM came up in 2005, a lot of capacity development initiative was at that time a generic institutional capacity development. It was like bringing peer-to-peer learning through this Pearl program, and a capacity building for urban development was essentially focusing on managerial efficiency and programming efficiency. Then, as new missions came, the National Urban Sanitation Policy came in 2008. Then it came with Swachh Bharat Mission, Amrut, Hriday, and these programs. Then more sanitation specific capacity development initiatives came in, including the sanitation capacity building platform where I worked for 5 years. And we also had the cities program, and it also had its capacity development framework, which had a maturation phase. So all this shows that there was a progression of specific capacity development initiatives and sector specific capacity development initiatives in the last 10 years, which wasn't the case before that. Finally, we have reached the National Urban Learning Platform and the Integrated Government Online Training I got, which has been approved last year. So there's a lot of digital content and capacity building which is now taking place in line. And therefore, we do expect as the new missions come up, this landscape will be more digital in future. Next slide, please. So in terms of categorization, if you see, we have definition of urban and rural. As per the 2011 census, there were about 7,933 towns, out of which the statutory towns were only about 4,041, meaning the statutory towns had an executive, a legislature, and some kind of a judicial system. So they were statutory in that sense. The others were more like census towns declared by states, but they did not have the institutions. So the number of towns, if you will see, the categorization and the definition is based on the percentage of urban population engaged in non-agriculture activity and density. So there are specific definitions which are there, and these can be, explained and therefore better understood in the kind of towns and metropolis which we are talking about. So if you see, water in urban India, according to, and this can be for rural also, according to, there are about, you know, India has only 4.5% of the freshwater resources for 17% population. This fact is there in all the books and publications. But what is more important is 80% of our drinking water and two-thirds of the irrigation are coming from groundwater. And National Institute of Hydrology, I think, it's important to understand 60% of the districts face groundwater exploitation. And Niti Aayog in 2018 had come up with the fact that our cities are running out of water. So that's how the bigger picture is. By 2030, the country's water demand is projected to be twice the available supply. So in the next slide, we will come to these figures of supply and availability. Next slide, please. So this is the kind of annual rainfall and the usable water supply. These are from two sources. One is from the Ministry of Water Resources, and then there's an analysis base from other authors. In both the cases, they come up with the same final figure in the green, which is that use will be about 634 billion cubic meters of water, well below the supply um, of currently it is below the supply. Whereas the independent users actually say that it is quite close to the supply level. 634 BCM is close to the actual current supply of 654 BCM. So the estimates are different on the basis of the evapotranspiration. Uh, the experts considered it at 65%, whereas the MOWR considers it at only about 40%. So there are these different figures, but nobody denies the fact that you cannot extrapolate total rainfall and come up with use figures. You have to go by city, state by state, district by district to come at actually what is the situation, because the situation is very variable all over India in the urban and rural context. But this is just the meta figures, which shows that we are close to actually reaching the supply limit of available water. Next slide, please. These are again, I'm sharing the standards of water supply, the norms. Uh, these are the urban supply norms. In the rural, according to the Jal Jeevan mission now, it has been pegged higher, and it's Har Ghar Jal, Har Ghar Nal. Uh, in the rural side, there is no fixed limit as such. Earlier, it used to be 40 liters per capita per day, but under the National Rural Drinking Water Supply, it was increased to about 70. Now, the aim is to cross 100 at least. Whereas in towns, it's been quite static. In the towns, we have these three classifications, and there are three recommended minimum or maximum supply of water. So towns with piped water supply but without sewerage was considered 70 LPCD per day, liters per capita per day, and towns with piped water supply and sewerage was 135. Now, if you see the Delhi Master Plan, which was released about 10 days ago, it tries to reduce this quantum by trying to make the system more efficient. But these are some of the norms which you should understand and know. And we also have the service level benchmarks on the right side of the table, which talks of what is recommended in terms of service delivery. What should be the coverage? What should be the quantity? What should be the extent of non-revenue water, extent of metering? So these are all standards and guidelines which are recommended by the Central Public Health and Environmental Engineering Organization, which works under the Ministry of Housing and Urban Affairs. Next slide, please. So, do we have enough water? Now, this graph by Kulkarni, it shows very nicely that if you look at the groundwater use and the surface water use, which together constitute water supply for urban areas, the groundwater use increases to some because you can extract water if it is available, but then it plateaus out. So the red line, if you see, goes up and then plateaus out, and the blue line is the line which is on surface water. So it shows that as you move from small towns to metros, in the small towns, the groundwater use is much higher than the surface water supply. And as we move up the surface water, the groundwater reaches a limit, it doesn't grow further, and all the excess of your water needs are met through surface water supply, which means essentially rivers. So you start importing water from faraway rivers. And it does lead to a situation where the groundwater may actually start falling. So 1, 2, 3 is shown three trajectories that if you don't do enough, then you can either the plateau will remain or it will come down. And if you actually recharge, you can start enhancing the groundwater supply. So this is again a presentation to explain the crisis which different kinds of categories of towns face for drinking water. Next slide, please. Next, please. Now we deal with wastewater. So this is a kind of picture of wastewater runoff in our cities, which shows that the water runs off through drains where you have poorest settlements along it, and the drains are filled with solid waste, plastics and others. Next, please. So if we see the urban sanitation landscape, the landscape is interesting in the sense that on the side, if you see what are the implications of rapid urbanization, and what are um, what are some of the requirements, and what is it that we want to achieve. Now we all want to achieve cities which are livable, resilient, which are citizen engaged and participatory. But where do we start from? Where we start off with the implications of urbanization, small and medium towns are expanding at a rapid pace. So this the census details showed that the growth in small and medium towns, percentage growth is higher than the growth in larger towns. We have informal settlements. Cities are home of migrants, which was visible in COVID-19 when we saw a massive outflux of migrants, to the extent some estimates say about 30% of Delhi's labor is migrant labor, but there is no formal estimation. And these are not served with sanitation and water facilities because they are migrant populations. They don't have residential safety or security here. Then we have shrinking public spaces, which not only includes shrinking of parks and gardens and lakes, but also wetlands and water bodies, riverfronts, which are supposed to regenerate our groundwater. And there is an increasing use of waste generation, including, of course, air pollution, but besides that, solid waste. So all this is leading to a situation where um, we see cities. If you work in cities, you find that the cities don't have financial autonomy. They don't generate tax for not even for them to pay for their salary and operations expenses, leave alone on investing something on water and sanitation. So they are forever dependent on either the finance commission grants or the state grants or the national missions grants to do anything on water and sanitation. Then we also see master plans and city sanitation plans are there, are instruments of planning. But to implement them, again, you require funding and finances. Technology solutions are usually focused on efficiency, affordability, and water conservation. But unfortunately, most of the cities end up having technologies which are neither of these. I mean, they are unaffordable, they are not efficient, and they don't lead to reuse or conservation of water. And habitat protection is another priority, which often does not get done. So next slide, please. So the desired outcome of livable cities and resilient cities does not materialize. Now, the urban water supply challenges broadly were shared, and it's just a recap of rapid urbanization. Uh, there's no treatment of wastewater. As we are talking of climate change and cities running out of water, unless you have reuse of treated wastewater for drinking purposes, you will not, in that graph, you will not find more rivers and surface water in future. You have to either conserve water and recharge your groundwater, or you have to reuse your treated wastewater. Our water distribution systems are problematic and they are very expensive. Water wastage and leakage is high. Um, Poor pricing strategies also is an issue, and the other are institutional challenges, which we will not get into detail, including the capacity of institutions to plan or implement decentralized sanitation solutions, which will come towards the end of the presentation. Next slide, please. So this is just a kind of a basic understanding and infographic of a nutrient and water cycle. There are two cycles in nature. There is one water cycle and there is another cycle called nutrient cycle. If you just click once more on that, please. So what happens in the nature? Both the cycles operate independently. What falls as rain comes down and then gets recharged, evaporates and goes up. And the nutrient cycle was whatever was generated as solid waste was then recycled as natural fertilizer. But what has happened in the last 2-3 decades rather is that both the cycles have got mixed up. So we what we generate from our nutrient cycle as solid waste enters our water cycle and pollutes the water. And at the same time, since the nutrient cycle enters the water cycle, we are not able to harvest the nutrient cycle into fertilizer. So we are depending on external fertilizer to produce food, and we are generating and throwing all our natural biomass or fecal matter into our water cycles. So this is just to show what is the problem in this case. Next slide, please. Hygiene. I brought in this topic because for NIH, this may not be a very familiar topic, but I thought it is important if you're talking of WASH challenges. H stands for hygiene in WASH. So if this is a very popular F chart, it is called, and F chart, it has um, 5 Fs. So feces, fluid, fingers, flies, and feels. So it says that if you are able to address these 5 Fs, then you can ensure a lot of your contamination does not reach the cycle of your healthy person or the person's body. So if you construct toilets, which is the first barrier called sanitation, you prevent feces from entering your water table. Uh, uh, the flies are prevented from sitting on the feces and bringing it on your food, and also on the floor. You don't catch them from the floor and the fields if people defecate. So the first barrier is sanitation. The second barrier is clean water supply. So you treat your clean your you either adopt safe drinking water systems, which may include safe storage, safe handling, and filters. So that ensures that your water supply is clean. But the most important barrier is the hygiene barrier, which says that if you do hand washing, if you ensure that your food is kept safe from mosquitoes and flies, and um, and you also perhaps wear footwear, and you have all these hygiene practices, then a lot of your um, fecal oral transmission, as we call it, will not happen, and the victim is safe. So, of all the barriers, sanitation, clean water supply, and hygiene is considered a very strong barrier. It doesn't mean others are not important. It just means a lot of emphasis on hygiene has to be there. Next slide, please. So, various estimates have been done on the impact of diarrhea reduction through various wash interventions. This slide I'm showing not because it's a very authentic slide. No, this is a slide which was prepared about 20 years back. It has a bias towards hand washing with soap because no study can categorize its participants or the universe into these 7 or 8 categories and just do one intervention impact on diarrhea. So this is like more like a conjecture based meta analysis which tries to show that hand washing with soap has the maximum impact on diarrhea reduction, whereas all other impacts are lower. So again, I'm repeating, this is not a quotable kind of a research, but it is quite popularly used in various hygiene presentations to show the importance of hand washing. Next slide, please. It's very interesting what has been the global wash health impacts. Some important trends have emerged, which are actually quite shocking. The first is that the incidence of global burden of disease from inadequate access to water and sanitation actually has fallen dramatically. It's less than 1% now. Similarly, global child mortality has halved, has come down, life expectancy has increased, with non communicable diseases becoming more important. So, what was earlier communicable diseases being more important and child mortality being half, because of antibiotics and a lot of curative measures, these have come down, and now we have non communicable diseases which are higher. Third is the child deaths from diarrhea have fallen dramatically from 2 million a year to less than 700,000. And disability adjusted life years, DALYs, lost due to inadequate health also halved since 1990. So, all that this shows us that perhaps major strides in the medical science and health have led to a dramatic reduction in what was earlier considered a wash kind of a disease burden has been reduced significantly. And this does not mean that therefore we don't need to worry. It only means that the impacts, it just provides us as a better understanding of the health outcomes through various angles. And we all know that a clean environment is a safe environment. So you don't need facts and statistics to show that if there is garbage next to your house, you're more susceptible to illness. You are. Of course, you may fall ill, but you may not die because the antibiotics may save you. But the DALYs would still be there. And they may not be because of inadequate access to water and sanitation, but they may be because of illness. For example, in Delhi, we have air pollution affecting respiratory systems of a large percentage of people, or we have other illnesses, chikungunya, dengue. So these are all also aspects of a clean environment which have an impact on the burden of disease, which is probably not accounted for in the earlier estimates. Next slide, please. So now we are coming towards the scope and challenges. In that's the title of the webinar also. So if I've tried to categorize the scope and challenges in 3 categories. So in water, if you see, availability and quantity is the first challenge. As I said, there is competing pressure. There are water conflicts now which are of many dimensions. They are, for example, rural versus urban. There are intra-rural. They are intra-urban. One colony in the urban area getting water, the other not getting water. They are industry versus agriculture. They are one state versus other state. So we know there is an issue of availability. That's why there is an issue of conflicts which is happening. Then the second aspect of challenge is the access to water. So access to clean water. HWTS stands for Household Water Treatment Systems. So access to pipe water supply. So availability may be there, but the access can be in different forms. It can be through pipe water supply. It can be constrained by affordability. Some water may be there, but you may not be able to purchase it. And then there is, of course, this issue of sustainability and quality. So sustainability in the sense of source, whether the water source will remain sustainable will be able to meet your requirements and water quality. Similarly, in sanitation also, it's in a similar frame of availability, access, and operations and maintenance and service levels. So broadly, if you see, both water and sanitation have a similar kind of challenge. Whether in sanitation, whether your systems are there, whether your toilets are there, whether your wastewater treatment plants are there, whether your solid waste management sites are there or not, and then whether who can access it, what is the charge for that, and then this issue whether there is operation and maintenance, because a lot of times our water treatment plants, our water sewage treatment plants, our municipal solid waste plants, they don't function even if they are there. And the 2015 CPCB report showed that as much as 62% of the sewage which was being generated in class 1 cities was not being treated. So it just shows that the plant may be there, treatment not may be. And similarly, in hand washing, there are these issues of hand washing facilities, menstrual hygiene management, MHM, and clean toilets, whether there is a provision for that. And then this issue comes in of long-term behavior change. And that is related to much deeper issues. It's not just about advertising and changing people's behaviors by telling them that they'll be happy if they wash their hands. It's much more to do with addressing their deeper perception and self perception barriers. Somebody may think that I'm poor, I have, this is my destiny, therefore I don't need to wash my hands or even take a bath. So those are very deeper self perception barriers. It's not about an advertising campaign that you conduct a television campaign or you bring in film stars. So it's a hygiene is a much, when we talk of sustainability, it's actually how people perceive themselves. Unless they change that, their behaviors may not change. Next slide, please. Next, please. So we are talking of cross-cutting challenges. These were thematic challenges. Now, cross-cutting challenges in water sanitation hygiene can be clubbed in these four realms: rights, sustainability, capacity development, disaster response. So they will cut across water sanitation hygiene. And I don't want to go through all of them. You can read them, but each dimension has many aspects. And these, I think, are the four cross-cutting themes which have become important and which are emerging as priorities now of challenges and actions. For example, capacity development and disaster response is now a major programming priority for most organizations to work on. Next, please. Okay, now we come to priorities and way forward. Next, please. This picture tells you about the sewers being cleaned, and this picture tells you about the water supply. Both these pictures, if you notice, we are depending on very big infrastructure. The earlier picture had sewer lines, and people are trying to clean the sewers, and this has this huge piped water supply network. Why these are important is to show that we are depending on large systems to cater to very dense populations, and the large systems require a lot of water. For example, our sewers, in order for the sewers to have gravity flow, they need water. And two-thirds of India is dry or semi-arid, and NIH would know this better than me. So in two-thirds of India, where we don't have enough water, we are relying on water-based sanitation systems, sewer systems, which get choked, and they require frequent cleaning. So the whole technology of sewers was actually from Europe. So Europe has a higher rainfall, and there the problem in Europe was actually flooding and how to get rid of high water. So sewers were therefore constructed, which were very huge sewers. You could run a truck through them. So the idea was that how these big cities like Moscow or Paris or London, how to ensure that they never get flooded if there is intense rain and water. Whereas two-thirds of India is dry, we don't have water, but we are still relying on very large sewer, centralized sewer systems, which often fail. Next slide, please. So here is a good National Institute of Hydrology kind of a diagram, which shows that what happens when, with time, a rural village scheme, water supply scheme, moves from scheme 1 to scheme 2 to scheme 3. So it shows that when the first scheme uh, is doing well, as the time goes by, the water supply scheme is able to harvest water, but then it hits a line which is mentioned as a restricted means of water use. And then they bring in good engineering and some new technology. Either they pump a deeper borewell, or they go 10, 20 kilometers away, as they do in Maharashtra and Telangana and Gujarat. They hunt for a water source away and then they bring it in the village, which is called good engineering. And you move to scheme number 2. Then the scheme number 2 also runs dry. After some time, with time, water demand increases. Then they run for scheme number 3. What this infographic tells you, can you click again, please, on this? So it is saying that with good governance, you can actually expand the scope of the scheme. Good governance meaning, if you control the demand for water, if you control the demand for use of water for either water intensive crops or industry, then that scheme length will increase. Otherwise, you will keep running out of water till you hit this eventual limit of supply, because supply is not unlimited. Water supply is limited. After some time, how many schemes and how many sources will you run to? And finally, you will hit the supply limit. So it is better that with governance, you try to expand the life of the scheme to make use of the available water. That is what this slide tries to show. Next, please. So now we are coming to priorities. And here I have listed down about 4 priorities. This is again from that earlier infographic of the cross-cutting challenges. So the priorities are governance, capacity developments, norms and standards, resilience, and disaster preparedness. I have broadly categorized them in these 4 priorities pillars. If you see, I have not included, for example, technology here. I have not included any institutional issue. Institutional issues are there actually in all, but they are from a nuanced aspect of governance, capacity development, norms, and standards. All these are institutional challenges, but they are defined. Not that you need more institutions, but you need the existing institutions to be able to deliver. Next, please. So currently, what happens is that most of our water and sanitation interventions work like this. It's an work in an inverted pyramid. What is shown here is what should be, but in reality, what is that engineering is the base. Then we come to water science. Then we come to mobilization, and lastly, we look at ecology. Whereas actually it should be the other way around. Instead of looking for engineering solutions, we should look at the ecological considerations and constraints. We should look at social mobilization, because ultimately people will use the water and sanitation facilities. And we should then apply good water science rather than jump to engineering solutions. So good water science would mean, for example, an integrated wastewater, water and wastewater management, or low cost systems, decentralized sanitation systems, instead of straight away jumping to the state of art UASB or some kind of very expensive pipe water supply systems as best fit engineering solutions, which will collapse because the other considerations have not been factored in. Next, please. So this is taken from the Ministry of Housing and Urban Affairs, Smart Cities. They had come up with a policy framework for urban water and wastewater. So the policy framework says that what should be the vision for, say, commissioners or city managers who take charge. So what aspects they should be looking at when they are given charge of managing a city, what should they look at water and sanitation? So here, two vision is defined as managing water demand and reducing the wastewater footprint. So if this becomes the vision of our urban or even rural district collectors or commissioners, then this should guide them that what is it they need to do to manage water demand, what they need to do to reduce the wastewater generation, which is called a footprint. Because you can't keep increasing the wastewater footprint and you can't keep increasing water demand and try to address it through technology solutions. So what are some of the policy commitments this policy framework of Ministry of Housing and Urban Affairs defined was that plan for integrated water and wastewater management, reduce NRW, because anyway efficiency is a priority with limited resource availability, ensuring universal access to affordable, safe, and adequate water supply. I think this is very important because you may augment your water supply, but it is not distributed fairly. Then some people will get more, others may not get anything. Then prioritize operations and management. This is also very critical. You can't keep adding more technology, more plants, more treatment plants, and they don't work. So, or more solid waste plants. So, and they don't do any recycling of liquid waste. So that will not work. Ending manual scavenging of septic tanks and sewers, that is still a priority even though there is a law, but it still happens. So it's both a social issue as well as a health and safety issue as well as sanitation challenge. And prioritize non-networking and decentralized sanitation system. This prioritization should happen, otherwise uh, we'll not be able to find India specific solutions to our sanitation problems. Next, please. So the next priority was capacity development. So if you look at capacity development under the United Nations Development Action Framework, this defines capacity building as three pillars. It says capacity building is not just training programs. So capacity development is building is first is the it's not first all the three. It says there are three pillars. So for one pillar is at the policy level. Policy is defined in terms of an enabling environment context. So you should build the capacity development should focus on the policy framework within which a sector, whether it is water sanitation or any other, works. So if the policy is an enabling policy, capacity development should be to try and build the capacity of the policymakers and the general public and its awareness to demand for policies which facilitate improved water and sanitation systems and institutions. The other second priority was on organization level. So capacities of individuals is important, but capacities of institutions is also important. So if an institution is not able to discharge its functions, is not streamlined to deliver on outcomes of efficiency of performance standards, say Delhi Jal Board or any institution, even NIH. So you need to do an audit of how is the institution, of carrying out its operations, decision making, communications, and how to improve its functioning, how to improve its decision making capacity, how to improve its financial systems. So all that comes under capacity of at the organization level. And third is finally at the individual level. So training programs, exposure visits, learning events, peer-to-peer learning visits. So specific capacity building interventions at the individual level. So these are considered as three pillars. Next, please. Another framework which came up was this capacity development effectiveness ladder. And this came up through our own experience on running a capacity development program in India. Uh, with the ministry through a Gates Foundation grant for decentralized non-network sanitation solutions. And in this program, we realized that a capacity development effectiveness is a better framework to look at rather than outcomes of capacity development, which are difficult to assess. For example, people often ask, you trained 100 people, did it lead to improved water supply? Did it lead to a bridge being built? Which is a wrong way to ask, because those 100 junior or middle level officers may not have the decision making powers to sanction budgets, to sanction approvals immediately after the training, or that what did the institutional outcome result in. It may not. You may do a good kind of an organization development intervention with all the officers with different levels, and you may suggest that you need to improve your financial systems, decision making, communications, but they may not implement it, or they may be implemented partially. So what is important therefore is, at the first step of the ladder is developing original learning content. So capacity development effectiveness should be assessed from a learning priority primarily. So whether it was a learning initiative or not, that should be the main focus of effectiveness, assessing effectiveness. So the first step is whether there was original content developed. A lot of capacity development programs I've seen end up as trainings which are cut paste presentations, material borrowed from Africa and shown in Asia, or from Asia shown in Africa, which is not relevant, PowerPoint presentations which end and then there is no follow up. So, developing original learning content is very important and should be the first step of a capacity development. And those who do this should be told to justify what is original in your content. Are there exercises? Are there learning games? Are there learning tools which you have developed or not? Second is partnership for learning and outreach. Now, somebody may say, well, this is just a process, partnerships are always there. No, it is whether you did a good analysis of uh, partnerships for both developing content and disseminating learning. You should be able to justify that you identified the best partners. You should be able to justify that you tried three, four options and some worked and some did not work. So, developing partnerships for learning and outreach is not just a process thing. You need to justify it. You need to explain why did you choose one partner and why did you not work with the other partners? What were some of the problems? And if you can justify that, then you can say, well, you've crossed the second ladder. Third is a learning strategy. Any capacity development program should not just be a set of training modules. It should be based on a strategy, a learning strategy. What is it that you feel needs to be a first phase learning, second phase learning, third phase learning, fourth phase learning, fifth phase learning? You, or how many modules? A, 1, 2, 3, 4, 5. So you should be able to again justify as a learning strategy, why did you take up one module for, say, commissioners, second module for engineers, a third module for administrative staff, fourth module for masons. So you should be able to justify that you were able to develop a learning strategy which optimized your resources and optimized your reach to critical segments. If you're not able to do that, then it means you don't have a learning strategy which is good enough. Fourth part is this step is this visioning change and designing solutions. Again, this is not just a formal wording. Any capacity development intervention should be able to use its own learnings. Like any team who is doing a long-term capacity development intervention should be able to develop its own skills to then suggest solutions. And that is what we are saying, visioning change and designing solutions. You should be able to say, okay, like in our case, we were working on decentralized sanitation systems. So we were able to use our own concepts and learnings to go to Port Blair City and say, on their invitation, of course, and give them a decentralized sanitation plan for Port Blair, which was very different from a centralized sanitation plan given by WAPCOS. So through our own work and our capacity development initiatives, we were able to suggest to the city that you have a combination of decentralized and centralized sanitation systems, how to manage your septage, fecal sludge septage, and how to manage your wastewater. So that kind of visioning change and designing solutions is like moving to practice. And unless you are able to demonstrate that in a capacity development intervention, don't think your intervention has succeeded. And finally, the highest step of the ladder is, are you in a position to contribute to the global or the national capacity development discourse? This is important for large, long durations, well-funded capacity development interventions like sanitation capacity building platform, which is funded for 5 years. So after 5 years, if we were just saying we have developed original content, if after 5 years we were just saying we have the right partnerships, we have the learning strategy, that is not enough. You've worked for 5 years, you've identified issues, you've come up with a learning strategy, your visioning change. Now, what is it that you want to leave behind as your contribution to the capacity development discourse? And this framework, the CDEL, was our contribution to the capacity development discourse. That this is how you should be able to assess, and this is both for practitioners and any evaluator. That if you go to an agency which is saying we are doing capacity building, ask them what did you do for 1, 2, 3, 4, 5. So in that sense, it is important to have a longer term vision for capacity development and not just uh, you know those three pillars like the UNDF framework. You may be doing for all the three pillars, but what is it that you are actually achieving is important. The last slide is on disaster. Next slide, please. Yeah. So as part of our work, we also looked at disaster response. And because COVID happened last year, COVID-19, so National Institute of Urban Affairs, we worked with our partner agencies, which were capacity development agencies, to do a documentation of how sanitation response was being undertaken by various cities in India last year. And uh, through our partnership with AIILST Mumbai, which is a regional center for urban environment and RCUES, they were able to partner with us to do this documentation, which was very difficult. It had to be done online. You could not make visits. This was done from April to August last year. And we tried to see in the 4 months what are some of the challenges and the cities faced. And we came up with this framework, which we call the Resilient Urban Sanitation Response Framework, RUSR, where we tried to assess on three parameters: swiftness, appropriateness, and effectiveness. How swift and timely was the response? So was there any breakdown? For example, in the first phase, about 2 weeks, there was complete lockdown. People could not move. Even sanitation workers could not move. What happened to your septic tanks? Were they being cleaned or not? Similarly, scale of reach. Were you covering the critical areas? You because a response may be swift, but was it appropriate? Was it reaching the areas like slums or unserved areas where it was required? Was there appropriate deployment of human resources? So was it swift, but was it ineffective in that sense? And third, when we talk of effectiveness, we were looking at systems effectiveness. So we saw that in COVID-19, for example, when the hospitals last year responded, they had one batch of doctors working in the OPD, one batch of doctors working on non-COVID cases, and a third batch of doctors for COVID cases. And a fourth batch of doctors was in fact kept reserved. So that is what we also mean in terms of a strategic effectiveness, systems effectiveness. Was there rosters of sanitation workers available at the city and state level, which could then be quickly mobilized and effectively deployed? So that is important as a learning for us. We felt this should have been done. It wasn't done. Um, and emergency measures taken. For example, what is the coordination between the disaster management agency and the state and city administration, treatment and disposal? So these are some of the things which we looked at systemic effectiveness. And again, we felt this is a good framework for any response, not just sanitation response, it could be a health response, it could be an education response. So that was my last slide in terms of priorities and challenges from WASH. I think that's the last one. Can you move the next slide? This is just a thank you slide. Yeah. So that is what is coming from my side. My email is there. If there are any questions and issues, you can always get back to me. I hope I did not take too much time. Thank you for your attention, and I hope this presentation was useful for you. Thank you very much.